Stop sanitizing everything, because the real danger isn't what's on your countertops. It's hiding in the walls, the wood pile, and the garage you walked through this morning. I need you to stop what you're doing right now, because what I'm about to share could genuinely save your life or the life of someone you love. My name is Dr. Whitfield, and after 28 years in internal medicine with a focus on infectious disease in older adults, I have seen what happens when people don't take this warning seriously. And I am not going to let that happen to you. Hantavirus is spreading right now, this week. And according to a 2024 surveillance report from the Centers for Disease Control, cases have been confirmed in 36 states with a 34% spike in reported infections compared to the same period last year. But here's what that report also revealed, and what almost nobody is talking about. Adults over the age of 60 account for a disproportionate share of the most severe outcomes. Not because older adults are more likely to be exposed, but because the aging immune system responds to hantavirus in a fundamentally different way than a younger body does. Your body fights this virus differently, and if you don't know that, you are not protected. Now, before we go any further, I want to tease something that is going to genuinely surprise you. When we get to number 2 on today's list, I'm going to reveal a common household habit, something millions of seniors do every single spring and fall that dramatically increases your exposure risk. Your doctor almost certainly has never mentioned it to you. I've had patients in their 70s tell me after I explained it, Dr. Whitfield, I've been doing that for 40 years. Please stay with me until we get there. But first, before we dive in, I want to ask you something. Leave a comment below telling me how old you are and whether you live in a rural area, a suburban home, or an apartment. I read every single comment on this channel. Your answers genuinely help me tailor future videos to what you actually need. So please take 10 seconds and leave that comment right now. Today I'm giving you 6 critical steps, ranked from important to absolutely essential, that every adult over 60 must take this week in response to the current hantavirus situation. We're going from 6 down to 1. Let's begin. Coming in at number 6, understanding what hantavirus actually is and why your immune system at 65 is not the same shield it was at 35. Most people have heard the word hantavirus, but very few understand the mechanism, and that gap in knowledge is dangerous. Hantavirus is a family of viruses carried primarily by rodents, most commonly the deer mouse in North America. The virus is shed through rodent urine, droppings, and saliva. When those materials dry out and become airborne, which happens the moment you sweep a garage, open a storage bin, or disturb an old woodpile, you can inhale the virus particles without ever seeing or touching a single rodent. Now here's where your age becomes critically important. A 2023 study from the University of New Mexico Health Sciences Center found that adults over 60 who contracted hantavirus pulmonary syndrome, that's the severe lung condition hantavirus can cause, had a 58% higher rate of requiring intensive care compared to adults under 45. The reason comes down to something called immune senescence. That's a medical term for the natural aging of your immune system. Think of your immune system at 30, like a well-trained fire department with 40 trucks ready to go. By the time you reach 65 or 70, through no fault of your own, that department may be down to 15 trucks, and some of them have mechanical issues. The response is slower, less coordinated, and the damage done before the immune system fully mobilizes is significantly greater. Additionally, inflammation, which is already running at a higher baseline in most adults over 60 due to a process researchers call inflammaging, actually makes the lungs more vulnerable to the fluid buildup that hantavirus causes. The practical takeaway right now is this: do not assume that because you feel healthy and active, your immune response to this particular virus is equivalent to someone younger. It is not. Accept that reality and let it motivate the steps that follow. Number 5, the immediate home assessment you must complete before this weekend. I want to tell you about a patient of mine. I'll call him Harold, 71 years old, retired electrician from Flagstaff, Arizona. Harold was one of the most physically capable seniors I've ever treated. Walked 5 miles a day, no medications, sharp as a tack. In March of last year, Harold spent a Saturday morning cleaning out his storage shed. No gloves, no mask, just Harold and a broom. 3 days later, he was in my office with what he thought was a bad flu. 2 days after that, he was in the ICU. Harold survived, thank God, but his lung capacity at his last checkup was down 22% from his baseline. That shed had evidence of mouse activity that Harold never even noticed. What Harold needed, what you need to do right now, is a systematic rodent activity assessment of your home's vulnerable areas. This means the garage, basement, crawl space, attic, any outdoor storage structures, and the area immediately around your foundation. You are looking for droppings which are small, dark, and pellet-shaped. You are looking for gnaw marks on wood, insulation, or food packaging. You are looking for nesting material, shredded paper, fabric, or insulation gathered in a corner. You are looking for rub marks, which are greasy dark smears along walls where rodents travel repeatedly. A 2022 report from the National Pest Management Association found that 29% of American homeowners had evidence of rodent intrusion they were completely unaware of. After 60, when we may spend less time in attics or crawl spaces, that number likely climbs higher. This assessment needs to happen before you touch, sweep, or disturb anything. Because the moment you disturb those materials without protection is the moment your risk spikes dramatically. Take photos, note the locations, and do not clean anything until you watch the next item on this list. Number 4, the personal protective protocol that most seniors skip entirely, and why skipping it can be fatal. If your home assessment in step 5 turns up any evidence of rodent activity whatsoever, you must, and I cannot stress this enough, must follow a proper decontamination protocol before cleaning. This is where so many people make a life-threatening mistake, and it's often people of your generation because you grew up being told to just clean things up, work hard, and get on with it. I admire that. But this situation requires a different approach. Research published in the journal Emerging Infectious Diseases found that the single highest risk activity for hantavirus transmission is dry sweeping or vacuuming an area contaminated with rodent droppings. The act of sweeping launches the virus into the air in a concentrated, breathable cloud. At your age, with the immune profile we discussed in step 6, inhaling even a small viral load carries serious risk. Here is the protocol recommended by the CDC and validated by infectious disease specialists. First, ventilate the space, open windows and doors, and let fresh air circulate for at least 30 minutes before you enter. Second, put on a properly fitted N95 respirator mask, not a cloth mask, not a surgical mask, an N95, along with rubber gloves and disposable coveralls or clothes you can immediately launder in hot water. Third, wet down the contaminated area with a bleach solution, 1.5 cups of bleach per gallon of water, and allow it to soak for 5 full minutes before you touch anything. This wets the viral particles and prevents them from becoming airborne. Fourth, use paper towels to wipe up the material, place everything in a sealed plastic bag, and dispose of it in an outdoor trash bin. Only after all of that should any mopping or cleaning occur. A woman named Ruth, 68, from rural Kentucky, called my office last spring after watching a video similar to this one. She told me she had been about to spend a morning cleaning out her basement, which she described as having a few mouse droppings. She followed this protocol instead of just grabbing a broom. When her nephew tested the space professionally, they found active deer mouse nesting in 3 separate areas. Ruth told me, Dr. Whitfield, I had no idea. I would have just swept right through it. Her story is not unusual. Her caution was life-saving. Before we continue to the top 3, the most critical steps on this list, if this information is helping you, please take 5 seconds right now to click that subscribe button and give this video a thumbs up. This channel exists to give seniors the medical information you deserve to have, and every like and subscription helps us reach another person who needs it. Thank you. Now, let's keep going, because what's coming next is where most people go dangerously wrong. Number 3, sealing your home against entry, the specific zones seniors most often miss. Removing contaminated material is only half the equation. If you don't seal the entry points, rodents return, and the cycle of contamination begins again. A study conducted by researchers at Johns Hopkins Bloomberg School of Public Health identified that 81% of rodent intrusions in residential homes occurred through gaps smaller than a quarter inch. Spaces so small, most homeowners never think to address them. After 70, we tend to be less mobile, less likely to get on our hands and knees to inspect the base of a water heater or to climb and check where pipes enter the home from the outside. But those are precisely the places that matter most. Rodents can compress their skeletal structure to fit through any opening their skull can pass through, and a deer mouse's skull is roughly the diameter of a standard pen. The areas you must inspect and seal this week include the gaps around all utility entry points where pipes, electrical conduits, and cable lines enter your home. They include the spaces between your foundation and your siding. They include dryer vents, which are a favorite entry point that almost no one thinks about. They include the gaps around window-mounted air conditioners, under garage doors where the rubber seal has deteriorated, and any area where 2 building materials meet with visible space between them. For sealing, use steel wool packed tightly into gaps, followed by caulk or expanding spray foam over the top. Rodents can chew through foam alone, but they will not chew through steel wool. Hardware cloth, a fine metal mesh, is ideal for larger openings like vents. This one afternoon of work can eliminate the primary access route that keeps rodents returning to your living space season after season. Number 2, the common seasonal habit that silently multiplies your exposure risk, and almost no one is warned about it. Here it is. The item I promised you at the start of the video. And I want you to really hear this because I have watched healthy, smart, careful seniors make this mistake repeatedly. Every spring and fall, millions of older adults open up spaces that have been closed all season, a seasonal cabin, a storage unit, a seldom used guest room, a boat stored in a garage. They open windows that have been shut since October. They pull out holiday decorations from attic storage. They open the garden shed for the first time since November. This act, opening a sealed and closed space that has been closed for months, is one of the single highest risk activities for hantavirus exposure because rodents thrive in undisturbed, enclosed environments, and those spaces accumulate contaminated material all winter long with zero ventilation. A landmark study from the University of California, Davis School of Veterinary Medicine found that enclosed seasonal spaces had rodent contamination rates 4 times higher than regularly occupied areas of the same home. 4 times. And because the space has been sealed, the viral particles in dried rodent droppings are concentrated, not dissipated. The first breath of air you take when you open that storage room can carry a significant viral load directly into your lungs. The protocol here is specific and non-negotiable. Before you enter any space that has been closed for more than 30 days, open the door or window and step back. Do not lean in. Do not take a breath in that doorway. Allow 30 minutes of open ventilation. Then, and only then, in your N95, gloves, and protective clothing, can you enter to assess and follow the cleaning protocol from step 4. I had a patient, Margaret, 74, from a small town in Montana, who spent every Memorial Day weekend opening up the family cabin that had been closed since October. She did it every year for a decade. When I explained this step to her, she went pale. I always bury my face in the first breath, she told me, because I love the smell of that old cabin. She has since committed to the 30-minute ventilation protocol. She has also discovered 2 years running clear evidence of deer mouse activity inside that cabin each spring, activity she would have disturbed face first without this knowledge. Number 1, the immune priming protocol that makes every other step on this list more effective. Everything we've covered so far is about external protection. This final step, the most powerful one, is about fortifying your internal defenses, because even with perfect environmental precautions, your immune system's readiness determines the outcome if any exposure occurs. After the age of 65, your body's natural killer cells, the immune cells that are first to respond to viral invasion, decline in both number and function by roughly 40%, according to research from the Buck Institute for Research on Aging. Your T-cell response, which is your immune system's targeted strike force against specific viruses, becomes slower to activate and less precise. Think of it like this. In a 30-year-old body, the immune response to a viral particle is like a smoke detector that triggers instantly and calls the fire department within seconds. In a 70-year-old body, that same smoke detector may have a 48-hour delay, and in those 48 hours, the virus is replicating unchecked. But here is what the research is confirming and what gives me genuine excitement as a physician. Targeted, consistent immune support in older adults can meaningfully close that gap. A 2023 clinical trial published in the journal Nutrients, conducted by researchers at Tufts University's Human Nutrition Research Center on Aging, found that older adults who maintained optimal levels of vitamin D3, at least 2,000 to 4,000 IU daily, combined with zinc supplementation of 25 to 40 milligrams per day, showed natural killer cell activity that was statistically comparable to adults 15 to 20 years younger. 15 to 20 years. That is not a minor improvement. That is potentially the difference between a hantavirus exposure becoming a managed illness versus an ICU admission. Here is the practical implementation you begin this week. First, if you have not had your vitamin D levels tested recently, request that from your physician at your next visit. The optimal range for immune function in adults over 60 is 50 to 80 nanograms per milliliter, significantly higher than what many labs flag as normal. Second, add a quality zinc supplement taken with food to avoid nausea. Third, and this is the synergy tip that amplifies everything else, take your vitamin D3 with vitamin K2 because K2 directs the calcium that D3 mobilizes into your bones rather than your arteries. They work together like a precision delivery system, ensuring the benefit lands exactly where it belongs. Beyond supplementation, sleep is non-negotiable. Research from the University of Washington found that adults who average fewer than 6 hours of sleep showed a 70% reduction in certain immune cell activity. Your immune system does its most critical repair and calibration work during deep sleep. Protect it like the life-saving biological process it is, because that is exactly what it is. Finally, reduce your sugar intake this week in particular. A single high-sugar meal has been shown in studies from the Linus Pauling Institute to impair white blood cell function for up to 5 hours after consumption. During a period of elevated hantavirus risk in your area, that 5-hour immune suppression window is a window you cannot afford. I want to take a moment here at the end of this list and speak to you directly, not as a doctor, but as someone who deeply respects what your generation has built and endured and survived. You have earned the right to feel safe in your own home. You have earned the right to open your garage and your storage shed and your beloved seasonal cabin without fear. The information in this video is not meant to frighten you into paralysis. It is meant to hand you genuine science-backed power over a real and growing threat. Your independence, your quality of life, the mornings you wake up and feel capable and present and fully alive, those things are worth protecting. And the beautiful truth that I have seen in 28 years of practice is that it is never too late to take action that matters. I have watched 78-year-olds completely transform their health outcomes with a single week of intentional changes. I have watched patients who thought their best days were behind them discover that informed action returns something they thought age had permanently taken. That can be you, starting today. All scientific references mentioned in this video are linked in the description below. Please consult your personal physician before making changes to your supplement regimen, particularly if you're on blood thinners or have kidney disease. If this video helped you, please subscribe to this channel right now because we release new research-based health information for adults over 60 every single week and you deserve to have it. Click subscribe, click the notification bell, and then leave me a comment answering this. Have you ever found evidence of rodents in your home or seasonal space? And did you know the risk you were dealing with at the time? I read every comment. I will see you in the next one.